preventing long COVID. In Pitkin County, in the past 2 weeks, 5 to 11-year-olds have actually made up the highest rate of COVID-19 of all age groups, and this is closely followed by 0 to 4-year-olds. This is not necessarily surprising, as 5 to 11-year-olds are the oldest age group at this point that are not yet eligible for vaccination, and they have been making up the highest share of cases in Pitkin County. These two graphs on the bottom are showing you some national data. The graph on the bottom left is showing you the proportion of cases by age group of children that are diagnosed with multisystem inflammatory syndrome, the condition I spoke on last slide. And you'll see that while it's still a very rare condition, only about 5,200 cases reported across the US, this 5 to 11-year-old age group does make up the largest share of cases that are being diagnosed with MIS-C. And then on the right-hand side, this is national data. You can see that 5 to 11-year-olds are really making up the largest share of cases right now across the country. So not just something we're seeing here locally, we're seeing this across the state. We're also seeing this nationally in that age group. So now to talk a little bit more plainly about vaccines in general. This is a busy slide, but I did pull this from the CDC. And I did want to highlight that, again, while hospitalizations and death in children are much less common than they are in adults, we had other diseases that we did not yet have vaccines for that had lower or about similar hospitalization rates that we thought we needed a vaccine for because we were concerned about how many children were being hospitalized. So you can see here that with hepatitis A, before the vaccine was available, less than one individual for every 100,000 people was being hospitalized. For chickenpox, it was between 4 and 31, and for the flu, it's about 30 to 80. COVID is right around 25 in the 5 to 11-year-old age group. So you can see it's pretty much on par or even greater than some of these other diseases that we ended up realizing a vaccine would be necessary because we're concerned with the rate of hospitalizations, right? Children should not be hospitalized. Children should not be dying. And the fact that we have diseases that are causing hospitalization and death is something we, of course, want to prevent. The chart on the bottom shows the average deaths per year caused by these different vaccine preventable diseases. You can see before the vaccine was available, hepatitis A was causing about 3 deaths per year, meningococcal disease 8, varicella 16, rubella 17, rotavirus 20, and then COVID-19 about 66 deaths per year in this age group. And so again, it just highlights the significance and where we're at. So while we look at the cumulative numbers of COVID-19, when we put it into perspective with these other vaccine preventable diseases, it does really indicate that there may be a necessity to try to prevent the number of children that are being hospitalized and dying from COVID-19. And then just to touch on the Pfizer's vaccine study and to give you some background on what this study looked at and what the findings were. And I'm sure Dr. Harris and Dr. Bernard will and can speak more to this, but there was about 1,500 children that were enrolled in this study that received the Pfizer vaccine. And so they received 2 doses of the Pfizer vaccine 3 weeks apart, and they actually received a third of the dose that adults received. So they received 10 micrograms, whereas adults had been receiving a 30 microgram dose. And then in the same study, they had 750 individuals that got a placebo, which was not the vaccine, but essentially a saline solution to assess whether or not there was a difference between the 2 groups. After this study began, there was another group that got enrolled of about 2,200 children that were also enrolled to continue to assess the safety. So in all, there was over 4,000 children enrolled looking at the efficacy of the vaccine in this age group. What they found is that the efficacy against developing symptomatic COVID-19 was about 91%, meaning that in those who were vaccinated, there was about only a very small proportion that went on to develop COVID-19. So in all, the vaccine was preventing a significant proportion of cases. 0 cases of MIS-C were identified in this group, and 0 cases who tested positive had severe outcomes. This graph on the bottom, again, highlights just the difference between the placebo group and the group that received the vaccine. You can see the group that received the vaccine in that blue line and the placebo in that brownish orange line. And you can see the rate of COVID-19 was much greater in the placebo group as compared to the vaccine group, which again tells us that there is an increased efficacy and there is a protective factor for those that received the Pfizer vaccine. And then really lastly, we want to touch on the side effects in 5 to 11-year-olds, as this is, of course, a concern for parents in determining whether or not they want to vaccinate their children in this age group. And this graph on the top, what it shows you is the proportion of individuals in the study that developed certain side effects compared with the placebo group. And so you'll see here that 7% of individuals that received the vaccine developed or reported fever compared to 1% in the placebo group. So of course, those who were receiving the vaccine were more likely to have a fever compared to the placebo, but overall, pretty low proportion. The most commonly reported side effect was fatigue, in about 39% of individuals that received the vaccine. Headache was only reported in about 25%, and then a few other symptoms, as you can see, were reported in a smaller proportion of 5 to 11-year-olds that received the vaccine. And this is following the second dose. It was pretty similar for the first dose, but as most of you who have received the vaccine as adults are aware, as the second dose tends to be a little bit more severe in terms of the side effects that are experienced. So I did want to show you the second dose here. And then comparing the 5 to 11-year-olds to the 16 to 25-year-old age group, you can see that side effects are much less commonly reported in the 5 to 11-year-olds as compared to the 16 to 25-year-olds. And this is potentially due to the lower dose that 5 to 11-year-olds have received. But again, it just highlights that while side effects do occur in individuals, they do appear to be less common than in adults. It is significant to note that there were no cases of anaphylaxis, myocarditis, facial paralysis, or appendicitis reported in this study. I will note that this was a fairly small study. There's about, as I mentioned, about 4,000 individuals. And so it is hard to, assess whether or not if you had a study of 20,000 people, whether or not you'd see a case or two of some of these other conditions. But in the study that Pfizer ran, there was no cases of any of these conditions listed down here. Very last slide I wanted to share is just some reasons for vaccinating 5 to 11-year-olds, aside from some of the ones that you probably already thought of. The first is to limit preventable illness and hospitalization in your child, and then to limit the amount of time that a child would need to spend outside of school and extracurricular activities. Obviously, if a child develops COVID-19, they're isolating for at least 10 days at home, and then those who are not vaccinated may also require a period of quarantine if they are exposed to someone with COVID-19 and they are not vaccinated. Those who are vaccinated do not require quarantine. So it does, again, enhance the amount of time that a child would be able to be in school. As far as protecting your family, vaccinating children can limit the spread of the virus to vulnerable family members, such as grandparents, those who have chronic illness, cancer survivors, or those who are undergoing therapy for cancer diagnosis, and many others. Obviously, we know at this point that the vaccines are not 100% effective, especially in those that are older or have certain conditions. And so ensuring that the virus is not spreading to those individuals as well as those who are unvaccinated is something to consider. And then lastly, in terms of protecting our community, the more individuals we have vaccinated, we can limit the likelihood of additional mutations and variants. We can keep our schools and businesses open, and we can reduce incidents that will get us closer to a pandemic end. So just a few additional reasons to consider vaccinating 5 to 11-year-olds, although I know that our doctors will have some more information to share as well. So that's all I have, so I'll pass it back on to Tracy.
Great, Josh. I usually don't jump into questions and answer, but there is a question that came in. I think it's to your first slide. So I would want to just tackle that one before we go further into the presentation. And the question was, what's the definition of vaccinated versus unvaccinated patients in these stats? So I'm thinking it's your first slide you showed. I.e. fully vaccinated or anyone with one shot is counted in vaccinated. Can you break that down?
Yeah, so these are individuals that are fully vaccinated. So this would be anyone that is 14 days past their second dose of a 2-dose series, or 14 days past their 1 dose of Johnson & Johnson.
Great. There's some great questions coming in, but I'm going to go ahead and continue on the presentation and then we'll come back to them. So with that, I'm going to turn it over to Dr. Catherine Bernard.
Tracy, thanks for allowing me to speak. I really have not prepared any slides for this tonight, but I did want to speak to just a couple of topics that Josh Vance just mentioned. As far as the increased risk of myocarditis with vaccination and the increased risk of myocarditis in the picture of MIS, the multi-inflammatory system problem that children develop post COVID-19, even with minor infection. And I'm just going to throw some numbers out there because this is one of the questions I get asked. Yes, we have seen a couple of cases, less than a handful, of myocarditis in the past year related to vaccination at Aspen Valley Hospital. Those cases have been mild. Those cases were treated with non-steroidal anti-inflammatories and discharged to home with normal heart function. The risk related to MISC, which can also cause myocarditis, is actually much higher to children who are infected with COVID-19. So the most recent study I saw published in August that compared this age range for 5 to 11-year-olds who are higher risk of getting myocarditis at baseline, although it's very rare condition, are 37 times higher, more likely to develop myocarditis from COVID-19 than they are just at baseline. So it really is a great thing to get your child vaccinated. Now, because these kids have not been vaccinated yet, they were not eligible, we can't compare how much more likely they are to get it from COVID directly related to vaccination. But we know that across the boards, you're 6 times more likely to get myocarditis after infection than after vaccination. So that's just really the point that I wanted to make. And thank you for letting me speak.
Thank you for being here. I'm going to go ahead and turn it over to Dr. Mary Harris. And Dr. Harris, I believe you're going to screen share some slides with us.
Yes, I am. I'm Dr. Harris. I am a pediatrician. I'm a general pediatrician. That means I see everything from snotty noses to nosebleeds, secondary to the snotty noses, to belly pain, to constipation and COVID. There was a lot of great data presented by the last 2 presenters, but I want to tell you about benefit to your kid, right? Not benefit to the greater community, not benefit to grandma. What's in it for your kid? So to that end, let me pull, yep, okay. I'm not as proficient at screen sharing as some of these other folks because I don't do this as much. Here we go. All right. So vaccines have been shown to work in older kids and in adults. There have been billions of vaccines given to adults and 7 million doses of vaccine given to sort of the older kids, so the tweens and the teens. And that has several advantages. So we have been able to study what happens to these older kids after vaccination, and that has implications for the younger kids. So we know the Pfizer vaccine works. It's 93% effective in the older age group. You can look to the CDC for the source of that data. And it has reduced bad outcomes for my teenagers, which is awesome. Josh showed the data showing the 91-ish% effectiveness of the younger Pfizer vaccine at a lower dose, which is awesome, right? And I've heard a couple infectious disease experts being like, well, why are we giving a lower dose to the kids and a higher dose to the adults? Well, some folks are talking about maybe studying the lower dose in adults. So this lower dose might be the wave of the future. But for kids, the lower dose does a couple really cool things. And I'll talk about that in a second. The FDA has approved it. 2 different advisory councils have approved the vaccine, and you can actually go get one of these vaccines right now if you feel like driving. My professional society has endorsed this vaccine. And so, you know, hopefully we're going to reduce illness, we're going to reduce hospitalizations. So we're going to keep your kid out of Catherine's hospital, right? Because God bless our valley, but we are not long on pediatric resources. If you have a kid and you've ever tried to access like psychiatry service or the GI service or any of those subspecialties, it's hard. So we want to make sure that we keep our kids out of the hospital so that kids get cared for appropriately, right? And kids are cared for most appropriately in their house by their parents. So now I'm going to, whoops, told you I'm not good at this. New share. Now I'm going over here. Well, can you guys see the one of my slides? So it's kind of blue and that's the one I want. So here's the next slide I'd like to talk about. All pediatric deaths are preventable. No kid in this age group should die. Period. End of story. Right now, COVID is the 8th leading cause of death. This is not acceptable to me as a pediatrician. This should not be acceptable to you as parents. This is wrong. So what we're hoping to do with vaccination is we're trying to balance the risks and the benefits, right? We're trying to prevent COVID-19, prevent hospitalization, prevent MIS-C, prevent post-COVID death, prevent long COVID, which is somewhere between 7 to 10% of kids. We have to balance that against short-term side effects, vaccine-related myocarditis, and the risk of any long-term sequelae. So how do we do this? How does that happen? We look at the data and we continue to look at data. The data that was collected to launch this vaccine is not the end of the data collection. Each and every kid that comes to my clinic, the Brooks's clinic, Fahi's clinic, wherever, if there's an adverse reaction, it will get reported. And that data will be consolidated and be used again and again and again. And if there's a danger signal, we stop. Just like the J&J vaccine got stopped a while ago, right? So this is how we keep your kids safe while trying to balance all of this stuff. And it's a dance, right? So we want to prevent COVID-19 for a bunch of stuff we've already talked about. But the one at the top, kids are people too, and we don't want them to feel bad. This vaccine will help them from feeling bad from a really dangerous illness. Kids don't get as sick, kids don't die as much. But remember, no pediatric death is acceptable, right? And it's nice to protect the community and all that other stuff. But basically, pediatric illness, if we have a vaccine that is simple and safe and effective, keeps our kids safe and keeps them feeling well. But what about side effects, right? So here are the side effects. So it's a little different slide than what Josh presented, but it's kind of the same information. But what I want to point out is that to the top blue line, that's the the side effects if you get the vaccine. Dun, dun, dun. The bottom line, that placebo line, that kind of orangey line, that's the side effects kid reported if they got the placebo. So they just got a little bit of like salt water in their arm. And so fever, yeah, that's real. More kids get fever, placebo versus the actual thing. But you know, kids got tired in both groups. Kids got headaches in both groups. I'm not saying that you know, a 28% chance of having a headache is not more than 18% chance. It certainly is, right? But part of what this says is that kids are tired and kids get headache. That blue top line also sort of shows why the lower dose was chosen, because there was a much higher rate of side effects in the 30 microgram dose, the big adult dose. And as the other data showed, didn't really protect people any better, right? So why give a big dose if you can get away with a small dose? Why? We don't. More data, different slide, same information, just kind of organized a little bit differently. Some people are visual learners and learn in slightly different ways, which is why this sort of gets repeated and repeated and repeated. The big thing on this slide is myocarditis, the acute myocarditis versus post-vaccine myocarditis. As Dr. Bernard spoke to, the heart infection, heart and muscle infection you get from getting real disease is much, much worse than if you are unlucky enough to get post-vaccine myocarditis. If you get post-vaccine myocarditis, you get better. Now, data hounds will find, I don't have it in this slide. Data hounds will find that there are actually 9 myocarditis deaths that may or may not have something to do with the vaccine. Okay, 6 of those 9 have been fully investigated. All 6 of those who maybe had a myocarditis related death were found to have like some other virus or infection that was causing their myocarditis. So they didn't have vaccine myocarditis, they had like proper infectious, something from the world myocarditis. So there weren't any myocarditis cases in the data that we have. However, when we open this up to millions more kids, right, that may start showing up. But from what we know, the vaccine-related myocarditis is a much less big deal. It's a much smaller event in the life of a child than proper COVID-19 related myocarditis. So more of this. All right, that's really what I wanted to share. So I'm going to stop. I'm long-winded. I like to talk. So if you give me more opportunity to talk, I'll go on forever, but I'm always happy to answer questions either in this forum or through the office.
We appreciate that you're here and we want you to stick around to answer some questions. And Carly, I think we might go ahead and take a few questions that feel like, well, we've got Dr. Harris and Dr. Bernard on before we move towards, you know, your part of the presentation, if that feels okay. All right. So I think one of the first questions I saw, Josh, did you answer this one? How does the size of this study compare to the size of groups studied before other vaccines were approved? Can you even really answer that? It's kind of a...
Yeah, I mean, it depends. Some vaccine trials were pretty small, you know, 2,000, 3,000, some are much larger. But I would say that with the Pfizer vaccine, although they only assessed the vaccine in about 4,000 kids of this age range, we've had, you know, many more thousands of people that were in Pfizer trials and now many more millions who are now vaccinated with Pfizer. So, you know, in terms of, you know, the safety around the Pfizer vaccine, you know, it's the same vaccine. We're just looking at a smaller dose in 5 to 11-year-olds. So if the question is, you know, really around, you know, the safety data around Pfizer, I mean, we do have a lot of data on it at this point. But, you know, in terms of other vaccines, like I said, it depends, but it's not an unreasonable sample size that they looked at.
Thanks, Josh. Here's a question. What are signs or symptoms that your child may have myocarditis? What should we look for? probably a Dr. Bernard, Dr. Harris question.
Sure.
So at home, before they get to Dr. Bernard, looking for a kid who's tired. You're looking for a kid who isn't eating right. You're looking for a kid who just, you know, that parent sort of thing where your kid just looks like they maybe have a fever and you give them some Tylenol and they don't get better. And they're kind of sick and they've got those sick eyes. Well, this is more of that. So they kind of look like a gray wet noodle, which is one of those things you don't really recognize until you see it. So that's what severe myocarditis looks like. So what I'm going to tell you as a pediatrician, not eating right, not sleeping right, acting really fatigued and funny, fever, just And then I'm going to send them to Dr. Bernard.
Okay, sure. And usually what we see by the time you get to the ER is significant chest pain, usually different, worse with positioning and inspiration. And what we do in the ER is we check an electrical picture of the heart. We check an enzyme that indicates damage to the heart muscle. And we usually treat with an anti-inflammatory, which cures the pain, generally after one or a few doses. So that's generally how they present to the ER, chest pain.
Great, thank you both. This is kind of a broad question. Why has coronavirus continued to increase compared to this time last year when over 2 billion have now been vaccinated?
I can start. I'd say the vaccines were, when they were initially developed, they were developed against the original wild type strain of the virus, which first circulated back in January 2020, a little bit into March 2020. And we know that the virus has substantially mutated since then. Which of course, whenever a virus mutates, you're going to have a reduced efficacy of a vaccine. So we do know that the vaccines, especially against the Delta variant, have a reduced efficacy, at least as it pertains to developing symptomatic COVID infection. So we are seeing, we're seeing breakthrough cases, we're seeing people that are testing positive, but what we're not seeing from these vaccines are a high proportion of people who are being hospitalized and dying who have been vaccinated. So, while we're seeing infection, again, it's the severe outcomes that we're really seeing the greatest efficacy of in these vaccines. But it certainly has to do with, it's a pandemic virus. It's mutating, and as it continues to mutate across the world and through different populations of people, we're seeing it. It's having an impact on our vaccines, and it is reducing the efficacy slightly. And so we're seeing individuals, who are breaking through at times. But again, the greatest proportion of people that are hospitalized and dying right now are people that have not yet been vaccinated.
Thank you, Josh. Do you have any information on when Moderna may be approved for kids? What are your thoughts on waiting for Moderna to be approved for kids, since it is shown to have the best efficacy against Delta and longest longevity for adults of the 3 US vaccines? Dr. Harris, go right ahead.
So when we initially wanted a vaccine, we wanted 50% efficacy or better. So when we're talking about Moderna versus Pfizer in adults, we're talking like 90-something% effectiveness versus high 80-something% effectiveness. So in real life terms, we're squibbling over relatively small gains. And if you ask Dr. Paul O'Leary, who sits on ACIP, which is one of the FDA advisory committees, and also happens to be on faculty at Children's Hospital Colorado in Denver, he says, get what you can first. So whatever shows up first, that's the vaccine you can and should get. Pfizer has submitted its data for teenagers, and they just got a response back from the FDA last week-ish that they needed to submit more data. So it might be a minute before they even get their older kiddo vaccines. And they got to do that before they can get their younger kiddo vaccines. So I got to tell you, I'm getting my kids Pfizer next week.
Ultimately,
Oh, go ahead, Carly.
No, I was just going to mirror that. I think Dr. Harris covered it beautifully and succinctly. We do not know when Moderna is going to be fully approved, if it will be fully approved. If you wait, you are throwing a little bit of caution to the wind, so to speak. And so truly getting the best protection that is available as early as possible is going to be kind of the best route forward. So thank you, Dr. Harris, for covering it in more detail.
And apologies, at one point I transposed Pfizer and Moderna. I'm sorry. I get really excited about vaccines.
That's all right. We have a couple questions about the studies that you referenced. And I think if there's a way we could share your information, even post it to our website for people, or if you want to, I mean, that'd probably be the best thing, is that we can post the slides and any links that Dr. Harris will share with us to the COVID-19 website for Pitkin County so that you could go take a look at that. This one's kind of a general question, not necessarily related to kids. And I am going to move over to Carly, your part of the presentation, and then back to questions. But what are the benefits of getting the vaccine if you have tested positive recently? Or what's even the directive that you might want to share with somebody about when to get vaccinated if you've tested positive recently for COVID?
I don't know if one of the doctors has a more medical insight, but the CDC did just release quite a good study. I will put it up I will try to answer that chat question with that link. But the CDC did find that there is added protection due to vaccination even after infection with COVID-19. And so we do know that there is a better protection getting vaccinated even after infection. And so that it is recommended. Ideally, you should not be symptomatic. You should not be ill with COVID when you seek that vaccination. But receiving that vaccine does increase your protection against further infections or with other variants as they come down the line.
Carly, with that, I'd like you to go ahead and give your part of the presentation, because some of the questions coming in are exactly about how to find vaccine for kids.
Absolutely. Bear with me while I share real quick. Let me kind of get it ready to go. It's almost there. All right. So I think the really big takeaway from all of this is how do we actually move forward and get kids vaccinated within Pitkin County. So again, I know we've harped on this a few different ways till Sunday, but only Pfizer has been approved at this time. And so Moderna is not, there is no set timetable for when we are accepting or looking at that approval. So right now, only Pfizer, and as Dr. Harris, Dr. Bernard, and kind of Josh were all addressing, the FDA and CDC approval, as well as some of those guidances, are linked directly here, and that it is a lower dose. So 1/3 of the dose, it is mirroring the adult vaccination regime, which is 2 doses, 3 weeks apart. And that this one has, during this initial rollout, has reverted to the initial Pfizer storage requirements for that ultra cold storage. We wanted to kind of set the expectation that logistically, this may be difficult for some providers to administer right off the bat, but that we have availability. It is in Pitkin County, but that this is a changing landscape and isn't just that same adult Pfizer that's been available now for almost a year. So there are some constraints here and there are some challenges to this. Really big push is that Pitkin County Public Health is fully committed to providing this vaccination to families and children as they want it, as they need it, as many as we can, as quickly as we can. So we have really worked hard to really push these community-based, school-based clinics that this vaccine is going to be available starting in the following weeks, coupled with working with our local pediatric providers to bring them on board as COVID-19 vaccinators. A lot of our pediatric practitioners have signed on, have gone through this really big effort to work with the state and the CDC to get approved as vaccination administrators, and we are ultimately just sort of waiting for that final word that they can go. So Pitkin County Public Health, again, is committed to kind of administering these doses while those pediatric practitioners come on board. And we're very fortunate to have the partnerships that we have with those providers in order to make that happen. So that was just brief summation of kind of the information previously presented here. The big one, I'm going to go into more depth about these clinics in the next couple slides. So this is just sort of this brief overview. The clinics that we are hosting are going to be in partnership with the Aspen School District for location, as well as the Basalt Middle School. It is not limited to students of those two schools. We are really lucky to have the educators on board and really trying to bring the vaccine into a comfortable environment for these kids. This isn't your standard vaccination campaign. You know, we get that this is very different. This is a challenging time for families and this younger age group. And so bringing the vaccine to them in a scenario that feels comfortable for them is really the biggest goal. So we have 5 clinics that are planned beginning on November 12th. And so one of them is with Pitkin County Public Health, Aspen Valley Hospital and Community Health Services taking the leads in this big partnership to provide vaccines at the Aspen High School Gymnasium. The other 4 clinics are going to be the following week. That is really going to highlight kind of Down Valley, Mid Valley, Aspen area, and really trying to make sure that we have coverage for our entire 5 to 11 population. So again, just to reiterate, regardless of county of residence or school enrollment, these clinics are open for this age group. Just to be clear, these are only for these age group. There are not going to be other vaccines available at this time. Again, just sort of reiterating that this new pediatric Pfizer dose is different than the adult dose. And so the big focus is making sure that we are providing this unique dosage to this newly eligible population. So there are not going to be other appointments available at these clinics for other doses or boosters, which is a separate conversation. That being said, between the 12th and the 19th, we have over 1,000 doses available by appointment. It's really, really exciting to have the support of all of our partnerships with the schools, with our healthcare providers, with the state. And so this is the opportunity to kind of jump on the bandwagon as quickly as you can. So a lot of availability. Going into a little bit more detail about some of these clinics on the next slide. So the big one that Pitkin County Public Health, Aspen Valley Hospital and Community Health Services is working on is the November 12th. It is going to be 3 p.m. to 6 p.m. So right after school in the Aspen High School Gymnasium. There will be parking available kind of ideally in that Aspen Middle School parking lot. It's a little bit larger, a little bit easier to access. The appointments are going to start right at 3 p.m. Arriving earlier is not going, we cannot administer earlier. We have kind of strict guidelines and rules as far as timing for drawing up doses and administering them. So 3 p.m. is going to be the earliest time slot. And please do come at that assigned time slot. So whatever appointment you do sign up for, please make sure to arrive for that time slot. It will be challenging to try to get all of those doses in if they all kind of clump together. So to try to reduce wait time, especially for this sensitive age group, do stick to that appointment as you are able to make it. We are very, very fortunate. We have 300 doses available, which is awesome. We are working really closely with pediatric providers to have that experienced pediatric vaccinator on site who knows your kid, who is very familiar with this age demographic. We have therapy dogs coming through that are going to be there to kind of help alleviate some of these fears. We, again, know this is unprecedented times, and anything that we can do to try to make them more comfortable, that is our main goal. So snacks for post-vaccination, there will be an animated movie playing during that observation period, which again is about 15 minutes. And so really doing our best to try to make this, if not fun, at least approachable and available to those kids. Just to highlight, the second doses are also going to be held with Aspen School District on December 3rd, and scheduling will be available for those at the day of the clinic. So when you arrive for that first dose, you will be able to schedule for that second dose as well. The following clinics, so is in partnership with the Colorado Department of Health and, oh my gosh, my brain's gonna fart. Oh my goodness, apologies. With CDBAG and the state mobile vaccination bus. So November 16th and 17th, that bus is going to be located at the DeSalt Middle School from 11 a.m. to 5 p.m. This is an all-day event. There's a lot of availability here, and it's really, really exciting to have them available for 2 days straight. That appointment link is there. Just note that in previous state vaccination buses, we have tried to allow for walk-ups. So especially as we talk about boosters, for this appointment, specifically for the pediatrics, it is going to be appointment required. There is a limited availability for walk-ups for all of these clinics, just based on day of cancellations or other various availabilities, but we really, really are encouraging parents and families and kids to make those appointments, to know what time you're coming to get that guaranteed dose. So again, available 16th and 17th in the Salt Middle School, and again in November 18th and 19th at the Aspen Middle School parking lot. So this is going to be a mixed clinic of indoor outdoor. Again, just make sure to monitor kind of wearing those masks and being aware that at that end of school time, if you're able to come earlier, you may experience a little bit less of a wait time. But again, honoring that appointment only will help that process along. So a lot of availability in the following weeks and months going forward into those second dose appointments coming up in December. So a lot of push here from the November 12th all the way through the November 19th. And I think that's all I had for scheduling. Ooh.
Great, Carly. I'm going to move a question. Dr. Harris, I know you answered this, but for everyone here, I think it's a good question. My child just turned 12. Can I request a smaller dose that is given to the younger kids? But I think it'd be good for the group to hear that because we might have a lot of people that have kids in between that 11 and 12 age range.
There are actually two questions in the chat. That's one of them, and they're closely related. So if your kid's about to turn, so they're going to turn 12 on the 19th, but you can get an appointment on the 16th. You can give an 11-year-old the 10 microgram dose and it will work, right? If they're 11 years, 11 months, there's nothing super magic about 12, except when you turn 12, the regulations around your kid change, right? At 11 months, 11 years, 364 days, the state says 10 micrograms. If I give your 11-year, 364-day-old kid a 30 microgram dose, our ability to be a vaccine clinic gets revoked, and I might have licensing consequences, as in, I might not have one. If you are 12 and 0 days, you have to get a 30 microgram dose for the same reasons. If you start the series at 11 years, 364 days, you will complete the series at the 10 microgram dose. Medicine picks a lot of lines in the sand, and we do that either by weight or by age. And for your immune system, it's your age that matters, not your weight. So, yeah, I mean, do I really want responsibility for answering that question on an individual basis? No, the state makes my life very simple because there are consequences if I don't follow their rules. And I like being able to pay my mortgage, so I'm not going to violate them.
I also think this goes to kind of the conversation of as soon as you can get them vaccinated, get them vaccinated. We know that both doses are effective. We know that both doses are safe. And the sooner that kids are able to get vaccinated, the sooner that they are safe from getting these severe COVID infections and passing it along to peers.
This is an interesting question, and I'm not sure, we don't have anyone from Aspen School District here. Will the vaccine be mandated in schools in Pitkin County? And Carly, you've probably had a little more insight into what that conversation looks like.
I will say that this is an impossible question to answer in this forum. This panelist group is, this hasn't even been broached in any of the conversations that we've had. So I think that is a question that many parents are probably asking, and I'm sure the school is asking, but at this time, there has been no discussion about it, that it has the potential to possibly change in the future, but.
Okay, here's another question. Oh, Mary, you've got this, but I'm gonna read it out loud so others can hear it. We have a 4-year-old daughter who turns 5 in December. Whoops. Oh,
That's
you
my
stole
fault.
it.
I was typing your response as you brought it up. You have a 4-year-old that's going to turn 5 in December. Can I get the vaccine or do I have to wait? You got to wait for the same reasons as the 11 to 12-year shift. Because we want to be able to provide vaccines safe and effectively. And that means we have to institute rules. And sometimes they're a little bit arbitrary. And that's one of them. But, you know, your kid will turn 5 before there's a 6-month to 4-year vaccine.
Josh, I'm going to give you this question, although it's kind of a loaded one. We were told we would go back to normal if adults vaccinated. Now, after plenty of vaccinations, we're back to masks and endless boosters. When do you foresee this ending? I think you're our guy that talks about how we are going to be learning how to live with COVID for quite a while, but I'm going to let you tackle it.
Yeah. Well, I mean, I think it depends on who you ask, right? I think some people did say that if we got enough adults vaccinated, we'd probably be at a point where incidence was low enough. I think others have said, you know, we've always needed children to be vaccinated. So I really think that one depends on who you ask. In terms of pandemic ending, I wish I had I wish I could tell the future, but that one's a tricky one, right? I think again with the increased mutations that we've seen. I think a lot of people thought back in June after we had a rollout of a lot of vaccines that we wouldn't see a wave of Delta. This is a pandemic that we've continued to follow and we've been learning as we go. And, I think we're of course doing our best to follow the science and, ensure that, we're doing whatever is, scientifically reasonable and trying to ensure that we get our incidence down to acceptable levels. But I don't have much of a better answer than that at this point.
No, I appreciate you tackling that one. Carly, I know you're answering it, but I think it's a good one for the group. If we schedule for the first dose, will the kids automatically be scheduled for the second dose?
Oh, absolutely. I was just typing that answer. So you will not be automatically scheduled. We know that plans change, especially with the holidays around. And so you are not going to be automatically scheduled when you arrive for that first dose, but you are going to be able to schedule for those second doses, ideally on clinic site. So when you show up, that clinic date and appointment should be available at that time. Sorry, that was a halting answer. But we are returning to the schools 3 weeks out to make sure that those doses are available to everyone who needs and requires that second dose.
And I know, Carly, you've been typing these answers, but back to the group who's been asking questions about scheduling. If you didn't see it here, it is live on the Pitkin County COVID website. The children vaccine section is it's highlighted and easy to follow right on that first page of Get Vaccinated. So don't fear, go there. And that's where we'll always have the updated information about the vaccine clinics. All right, I am gonna go ahead, Dr. Harris. You're muted.
Okay, so if you're a working parent and for whatever reason the 16th and the 17th or the other dates don't work, use your Google skills. Google Foo, for example, the Brookses, so GMA, Glenwood Medical Associates, Down Valley. You can also schedule a vaccine there sometime after the 12th, which is when we have our site inspection at Aspen Medical Care. We'll start to be able to do it. So, if your schedule doesn't allow for the actual bus clinics, don't give up. My schedule doesn't allow for any of the awesome vaccine clinics being offered by Pitkin County. So we're trucking down the road to go to Glenwood Medical Associates. There is no shame in doing a little traveling.
And I also mentioned we have all those clinics throughout the Roaring Fork Valley on our website as well to connect with, to find out about how to get appointments scheduled. Here's another great question, and I'm actually going to take this as the last question. My daughter has a corrected heart murmur. Any concerns with that and an increased risk of myocarditis? I got it right earlier. Now I'm struggling.
So if you have a corrected heart murmur, so you had some sort of heart defect and it's been corrected by a cardiologist or a cardiovascular surgeon, they want you to get the vaccine, right? Because even if your kid is super unlucky and gets vaccine-associated myocarditis, your risk is that is much lower than getting myocarditis with wild type, COVID. You reduce the risk of getting any kind of wild type COVID. So even in the worst case vaccine scenario, you get the vaccine, your kid gets myocarditis, they are going to do well. The American, I think the adult cardiologists, and I know the pediatric cardiologists have come out saying in pretty big wavy language for very staid cardiologists to get the vaccine. Also ask your pediatric cardiologist, right? If you don't want to trust your general pediatrician, ask your kid's heart doctor. They will be happy to answer this question and provide, they'll be able to provide very specific answers for you. So if you have a kid with a comorbid illness, ask their specialist. I am not the be all end all, and that's okay.
Hey, this is another great question. I said the last one, but then this one feels like a really good one. What is the recommendation for flu vaccine and COVID vaccine? Should they be spaced out? ? One before the other ?
No. The American Academy of Pediatrics and all the other bodies say get whatever vaccine you can whenever you can. If it's 2:00 on a Tuesday and you happen to roll by a flu clinic, get the flu clinic. If then you happen to be able to get the COVID vaccine 2 days later on Thursday at 9 a.m., get the COVID vaccine. You can get them on the same day. You can get them 2 weeks apart. We don't care. And neither does the CDC.
So I know there are probably some other questions we didn't get to. Rosa, I think you're on. Can you share our email for questions that people might have that we didn't get to that we could then tackle as a team? So Rosa, can you unmute and go ahead and share our email for that?
Yes, that would be the covidhelp@pitkincounty.com.
Great. Well, I always promise my panelists that I'll get them out of here because it's late and some of us have kids and some of us are still working and have kids. But really appreciate everyone who tuned in tonight. Again, we will have this recorded. We will have it on the COVID-19 website for Pitkin County. Again, that email covidhelp@pitkincounty.com. If you have questions that we didn't touch on, you're welcome to submit those there and our team will tackle them. To the panelists tonight, this was fantastic information, so helpful. We're so lucky to have you and there's a good chance we'll have you back if we have more questions come up as we move through this process. But again, thank you for joining us tonight and everybody get out there and get your kiddos vaccinated and have a great night. Thank you.